So welcome to the Healthspan Podcast, where we talk about the science of longevity. And it is a great pleasure today to have Dr. Linda Eller on the podcast. So Dr. Eller is a concierge primary care physician at Benessair Wellness, a concierge medical practice that helps their patients live better and longer. I've known Dr. Eller for a few years now, and I can tell you that not only is she a great doctor, really a remarkable human being, and apparently a great cook as well. We're going to talk about that a little bit in here just a minute. Welcome to the Healthspan Podcast, Dr. Eller.
Thank you so much, Todd. Thanks for having me.
Oh, it's just an honor. So anyone who meets you, like within seconds, they recognize what a kind person you are. Like you just have such a positive energy about you. What led to you becoming a physician?
I think that's like such a great question. Everyone wants to know what led a physician to become a physician. For me, the biggest thing was I always had really amazing healthcare providers as a child. And unfortunately, I had a mother who had a lot of health issues. So I became her health advocate by the time I was in high school. I had a really incredible journey. I actually wanted to be a physical therapist. So when I was 16 in high school, I got my nursing assistant license and worked in a physical therapy clinic, inpatient, outpatient, for about 4 years, and realized that I wanted to become a physician instead. I wanted to completely take care of a patient, not just one aspect. So that's what led me into primary care.
Yeah, funny, I was a nurse's aide. Oh, that's what they called it back then.
Yes.
Nurse's aide. When I was in college, I'd already decided, I've always kind of loved math and physics. And so I was about second year of college, and I'm like, I don't know about this medicine thing. I'm just going to go into engineering. But my mom had got me a job as a nurse's aide over the summer at the local hospital. And I worked there, and I'm like, this is what I want to do.
And I find there's something really special about a physician who's worked from the bottom up.
Yeah, it's rare, right?
It is rare, and you learn how to take care of a patient completely, and nothing's beside you.
Maybe that's why we practice so similarly.
It is.
So that'll be my advice to pre-med students now. Go be a nurse's aide.
Yeah, be a nurse's aide, a scribe. Do something to help take care of patients early on, because it's only going to empower you to be a better provider, for sure.
Absolutely. I love how you describe the style of your practice as empowering your patients by involving them in every step of the decision-making process. And then, the true healing, it begins with understanding each person's unique story. I love that so much, because what you're describing there is maybe what led me into wanting to be a physician, was the power of the doctor-patient relationship. But the reality is, once I became a physician working in, I'm just going to call it corporate medicine, there really wasn't a lot of time to develop a relationship. How did you come to this model of care?
Oh, goodness. So early on, I think as I became a provider, I really had impactful moments with my patients that really led me to realize I wasn't treating them the way that they needed to be treated. I wasn't asking the question of, why won't you take this insulin I prescribed? I first started off by doing a few minutes of extra time of asking, well, this insulin, you're not taking it, you're diabetic, your A1C's 12. What can I do? Why don't you want to take this? Well, I never asked if they had a needle phobia. I never met the patient where they were at. And in that, I started to hear all of these amazing podcasts, when podcasts were just starting to become a thing, about shared patient decision-making. And I tried it, and I loved it. And it really exploded from there. I had different career changes and different paths. And there was a time where I had started a new job. I was pregnant at the time, so they didn't really push my panel. It was amazing, because I could spend 30 minutes to an hour with patients if they needed it.
Right.
And that's really when I had an opportunity to explore and develop that. When I had a chance to tell patients about their health journey, what it was like, and listen to them, and then come up with a solution that worked for them, but by educating them and also giving them choices. You don't have to have my way or no way. Let's find a way that works.
Yeah.
And pivot when it doesn't work.
I give a lot of credit to my career at Mayo for giving me that opportunity, because we had 45 minutes for a new patient visit, which is insane in the real world, right? But I doing that, it just helped me understand the power of having that time with my patients. And then how enjoyable it was as well. Like I got to know them as a person, and not rush them off and the 7-minute visit while your hand's on the handle of the door.
Yeah.
Otherwise I would never have had that experience and wouldn't have known.
I know, and really traditional primary care, and I came from the community health sector before I decided that I needed to change and pivot and become a concierge provider. Goodness, my first job out of residency, it was 26 patients in a 7-hour period.
Wow.
Back to back, and then trying to squeeze someone in between there. And as a primary care provider, you're asked to take care of everything. Right. And I like to practice as that traditional provider, or I do everything. Yeah. I'm managing their diabetes. I'm managing their high blood pressure. I'm managing their heart failure. But in that span of time, you can't do anything.
There's no way. Plus you have to document and,
Yes.
all those things as well.
Yes.
Well, and as a cardiologist, I always had that extra empathy for the primary care doctors, because at least when they said, well, I had this rash, I'd say, talk to your primary care doctor about that. You didn't have that option.
No, I never have. I think that's really what got me into functional medicine too, is learning more about that piece too. And I know we'll chat about that here shortly, but taking care of all of the systems and understanding how they come together. But no, nothing's ever passed off on the primary care.
Right.
You've got to know everything, and it's a blessing in so many ways when you have the time.
Yeah.
When you don't have the time, it is the worst thing for the patient.
Yeah. So you practiced for a while at 26 patients a day. Now you're in a completely different practice. What's your level of satisfaction with your job then versus now?
Oh my goodness. Actually being able to get to know my patients for who they are and what motivates them is so exciting. Getting to take care of their entire family is very exciting because I can actually help them. I don't leave the workday thinking, God, if I had 5 more minutes with that patient, if I'm worried about that, I'm going to pick up the phone and call that patient right now because I have the time.
Right.
And I have the energy to be able to do that. I have the energy to give my patients their undivided attention during that 15 appointment about their one health issue, or during that hour and a half medical intake when I'm just getting to know their health history for the last 50 years.
Right.
It's an amazing opportunity, and it really drives home why I became a healthcare provider, because I actually am impacting the patients and improving their health.
So that power of being able, one, to have the time to ask the questions, to get to know them, but then you have the time overtime as well, right?
Yeah.
Like So how many times are you you're going to know something from a prior conversation that you've had about them that's going to be the clue that's going to get you to the answer, and
it's
much faster.
so many times. But then it's also, I have the time to document. I have the time to really create a healthcare plan.
Right.
So I might talk to them for an hour and a half at their intake, but I'm going to go spend another 20 to 30 minutes just developing what I want to do for their annual exam.
Right.
Because I want it to be comprehensive and patient specific. So that personalized healthcare, never had time for that in the regular sector. Insurance wouldn't allow for it. You know, when you have a company that has to be by RVUs, so you had a certain amount of patients per day just to make the quota, it's a different moneymaker. It's not what brought us to medicine.
So I try to explain this, and I struggle with the words, because telling somebody that says, well, why would I do a membership model of care? My insurance, I pay and I understand this. I pay a lot of money for my insurance. It should take care of this. And why would I do? And to tell people, well, you get a lot more time with a doctor. Well, I don't know. Do I want more time with a doctor? But one of the real advantages is that. What you mentioned just now, the personalization. Anybody who's a clinician, I always can tell when somebody's giving a marketing thing, if they're a clinician, they're humble about what works and what doesn't, right? Because we've been humbled. Whereas somebody who's not a clinician will say, well, everybody should follow this diet or take this supplement or whatever it is. And we know, okay, there is no one size fits all, but most medicine is algorithmic. It's,
it is.
check the boxes. We get the time to really figure out what's going to be right for this person. It is
really the time. So in a traditional model, you don't have that time with the provider, and they don't have the time either. If they did that for all 20 to 30 patients they saw that day, they would never have a life, I'm going to be honest, because everyone does value a work-life balance. And as a patient, I've had many patients say, you need to have that too. Like they care about you,
Right?
like you care about them. And so a concierge model is phenomenal for the right patient. It's not for everyone. One, it does cost more. But luckily in the area that we're in, there's all sorts of different ranges. You could pay $2,000. You could pay $25,000.
Right.
You know, we at Benessair, it is a luxury. It is a luxury wellness center in that sense. And so our price point is a little higher than the average, but you're getting so much more for it.
Right.
And so it's really about finding the right provider for you. What services do they offer under their roof, and how does that fit for you? Don't spend the money if it's not the right fit.
Right.
You know, but again, it's going to be for patients. Some people who are unhealthy, who don't get the time with their provider, might seek that. I have a lot of patients who are healthy, who want to keep that health.
Right.
And that prevention is something that really strikes home to me. If you can prevent those disease and illnesses by spending the time for those personalized labs, those personalized imaging that's recommended, or a really good physical exam, you can prevent so much and keep you healthy. So it's really for the whole gamma. At Benessair, we do have patients that are very healthy, that want to keep that. We do have patients that are very unhealthy, and they might be in their advanced last years. But we're really optimizing those last few years. We're really making sure they have their quarterback on site, you know?
You're talking about medicine that's quite different than traditional medicine. I mean, you know, traditional medicine has been reactive. When you have the problem, you have a symptom, you come see me, I'm going to do a bunch of tests. We're either going to diagnose it or rule it out. And then, you know, off you go. What you're talking about is a proactive approach.
Yes. If we can find the problem, perhaps before it becomes a problem. And that's kind of where functional medicine comes in as well, getting to the root of the healthcare problem. And it might be as simple as, I have fatigue. Let's look in deeper into that fatigue. But you can actually unsurface things that could happen in someone before it becomes an issue.
Right.
Such as those inflammation markers might go up and you're seeing that you're really close to prediabetes.
Right.
Let's focus on this, bring it back. So it's really bringing in every element, but having the time for that provider to go through those tools, that discussion with the patient too. Because some people are saying, oh, you're a little fatigued, sleep more. Well, what if it's that you actually need to do more mindfulness, more stress reduction to sleep better?
Right.
It's actually having that time, and all of that will prevent illness in the long term.
Yeah, it's an investment, you know, of course, as we just discussed, but I think people are increasingly recognizing that if their goal is outcomes, you know, health, relying on an insurance, you know, based reactive system isn't going to be the best approach for them getting the results.
Unfortunately not, but as an American, all of us are taught that you have to have health insurance to be healthy.
Yeah.
And unfortunately, as I know you've discussed, and I've seen some of your lectures as well, that's not what keeps people healthy.
Yeah.
Unfortunately, it's not. So we need to think out of the box. And us concierge providers are doing that. We're thinking out of the box to actually restore health in our patients or keep that health that's already there.
Yeah. How do you know, I'm curious about blending. So you're a traditionally trained physician like I was, or am. I guess I still am.
Still are.
Yeah. And, you know, I don't know about your training. Maybe it was a little bit more, you know, acceptable of things outside of the guidelines than mine was, because cardiology is very evidence-based. You know, family medicine is a little, not less evidence-based, but a little bit more accepting of other approaches. But, you know, there's things that conventional medicine is amazing at. Like, oh my gosh, we have tools that are mind-boggling what we can do for people. But we also have a lot of limitations if we're just going to say, well, if it's not published in the New England Journal of Medicine and it's not, you know, in the ACC guidelines, then we're not going to do that. How do you draw the line, though? Because there is we don't have great evidence, but we have this evidence. Like, how do you navigate that with your patients?
That's hard. So some of it's based off of experience, too. So I am a functional medicine provider, so I have done lots of training through the integrative functional medicine model, which is getting to the root of the healthcare problem. It's really diving deep and asking the why question, but asking not just why do you have this, it's asking the why multiple times. So you have, diabetes. Why? Okay, so you have a bad lifestyle. You don't sleep well, you're eating bad food. But what brought you to that? And we literally go all the way back and thinking all the way from the time that you were in your mother's womb. All of those things create our health from the moment that we're conceived. Yeah. So it's really understanding the patient in their entirety, their life journey, and bringing it back to the present and how that affected them. And so a lot of it is so patient-centric. So I work with the patients to know, do you want traditional? Do you want the regular pharmaceutical drugs to treat your issues? Do you want lifestyle? Or do you want something in between? And I've always practiced with lifestyle first, always, without knowing that I was doing functional medicine in the sense of we need to exercise, we need to eat healthy, we need to bring all these things to the table. But when I really got functionally medicine trained, I really realized the impact I can do with that. And I asked the patients, because this is their body, here are your options on your health issue. You're diabetic. Your A1C is not too high. We don't have to do insulin. But what lifestyles can you make? What changes can you make? Well, I won't give up my cheeseburger once a week. Okay, maybe we can make it a healthy cheeseburger at home and use good quality ingredients versus getting it at McDonald's. It's really meeting the patients where they're at and bringing it together. And a lot of things in functional medicine are evidence-based. So I think that's kind of a misnomer as well. Is there are a lot of things that have been doing for years and centuries, and we have the evidence to prove it. And now there's more and more research saying that there are these botanicals, herbal supplements that actually help.
Right.
And it's, I think during the pandemic, there was some information brought out about vitamin D, the importance of vitamin D that helps our immunity. So it's really understanding how these things go together and why it really helps. So there's still a lot of evidence-based medicine there. It's just not ran by big pharma.
Yeah. Yes, that's a really good point. I talk to patients about that a lot. That there's a lot of money in sick people. Meaning keeping people sick. It's 18-19% of the GDP of the world's largest economy, right? And so that. Sometimes those decisions or the recommendations, the pharma is their business benefiting, but they're not patient.
It's not patient forward. Yeah. And then a lot of these medications have other side effects downstream. That example metformin, it depletes your B12. So you got to take a B12 supplement when you're taking metformin. Right. So it's all of these things and understanding how it comes together, but how that can create other nutritional deficiencies. But also meeting the patient where they're at too, as you had to ask, like, how do I decide on what to do for each patient? Each patient, I just have that conversation. Like, here's the spectrum, where are you at? Yeah. And then we have an issue, and I offer them multiple options, because rarely is it one option. It's one thing if you're having a heart attack or stroke. Right. That is really where our medicine lies. I mean, you have a heart attack or stroke, we have so many interventions to save your life. Right. And that you're going to still
we're great at it.
We're great at it.
Yeah.
We're great. But working on the prevention, we're not, because there's no money in it. Yeah. But it actually saves our economy money. It saves our patients money. Right. You investing $10,000 in your health a year, is going to save you hundreds of thousands later on in life.
The return on that investment is
huge.
is really
huge.
Is really high.
Yeah.
It's I don't know. I love thinking through this and talking about it. What and what you said is exactly what I've recognized too. Is that if somebody says, "Oh well, is X good?" Well. I don't know. I mean, for some people, it's a really great option. For other people, they would say, no, that's not the right way to go for me. And so that's the important part of having the time and being able to personalize things, because everybody has a different viewpoint, preferences, risk tolerances. And, you could see somebody who has the same criteria for whatever intervention or medication, but they make opposite choices, and that's good. That's the way it should be.
That's the way it should be. And also realize, though, each one of us are so different genetically. I mean, how we're going to respond to that medication and treatment is so different too. So they could say, well, my sister didn't do well with that antidepressant, so I don't want that antidepressant. And actually, there's some truth to that because we don't really know fully how our genetics will dictate how we process and metabolize these medications. So it's a really fascinating world, and this idea of personalized medicine, once patients have experienced it, that's all they want.
Oh, yeah.
They recognize it. They recognize when they have someone who's just cookie cutter. They just kind of checked all the boxes. They will come to you with that. And I'm sure you've experienced that too.
Right.
You know, it's just like, well, I don't have to take this statin. Yeah. There is an alternative.
Yeah.
I can do this, or, you know, because they don't have the disease.
Yeah. I had a patient, I'll just tell this story real quick because it was just so interesting. But she was 71 years old, and she had an LDL cholesterol of 180, which, you know, is probably top 5th percentile, like really high. LP(a) of 425, which is the second highest I've ever seen. I had a few, well, maybe third or fourth highest, but really high LP(a). She didn't want treatment, but her doctor was like, you have to take a statin. So I'm like, I don't know if you need to or not. We did a CT angiogram with plaque composition analysis, 0 plaque. Yeah. 0 plaque. And her carotids had no plaque as well. I'm like, she says, well, do I need to take a statin? I'm like, I don't know why you would, you know, like, you're, if you want to check the algorithm, by all algorithms, you should be on a statin. But when you look at your arteries at 71 years of age, they look great.
If you're clear at that age, the chances of you developing a heart attack or stroke are
pretty low.
Minimal.
Yeah.
And trying to explain that to patients, and because it's so been ingrained to them.
Right.
Like, this is the way of this. This is the way to that. And it's really hard to undo that. But once you've undone it, the patients are so open and receptive to understanding how their whole body works.
Right.
And again, that goes back to empowering the patient to understand about their health and help them to make the decision that's best for them.
Yeah. Yeah. It's so much fun to practice this way, isn't it?
It is. It actually brings a lot of just joy and you know, harmony. It's something that I've not ever experienced being a healthcare provider before.
I have a lot of empathy and maybe worry for our colleagues who are in corporate medicine. Like I you know, they're I mean, I talk to you have friends, I have friends, and they're frustrated, they're burned out, and you know, patients come and they're like, well, Dr. So-and-so spent 7 minutes with me, and they're upset with the physician, and I'm always defending them, saying, you know, the physicians do not want to be in and out of the room in 7 minutes. You know, but when they have when they're being directed, okay, you're behind on patients, you know, didn't meet your RVUs, you didn't hit these targets, they're going to lose their job. They're going to lose their livelihood. You know, they're in a really tough position as well.
What a lot of people don't recognize is that physicians, some of the country's most educated professionals, are treated like Amazon assembly workers.
Yeah.
How much can you package? How much can you package correctly? And how much can you get out the door?
Yeah.
And when you really put it into that perspective, it's like, why are we doing this? Then just have a computer doing it. People don't want a computer treating them. They want a human.
Right.
We need to take it back as providers.
I agree.
Again, that's where Concierge comes in.
Yeah.
Is really bringing that doctor-patient relationship back. It's what drove all of us to be clinicians.
Right.
And that's why we're here, is to provide excellent, quality, personalized care.
Was it a hard thing for you? I mean, I know there's a lot of, I had it as well to, you know, do the go to a membership model that, you know, I'm like, there's this natural fear in physicians probably. I mean, at least I had it, is that, well, I'm not here for the money. I don't want somebody to say, oh, you're just trying to get rich. I mean, like, goodness gracious, go look at my bank account. If you really think I was there getting rich before. Yeah. But did you struggle with that? Was that like, you know, I don't know, concierge?
For me, I struggled a little bit in a different way. So I went from a community health sector, so working with the medically underserved, the disadvantaged, to concierge. So in my mind, I'm going from poor to rich.
Yeah, exactly.
And, you know, and when I really honestly realized is that everyone deserves quality healthcare.
Yeah.
And I had to really work on my own mindset that I was worth that dollar amount.
Yeah.
that my education, my expertise, my ability to express to a patient what's happening, my ability to handhold them through as a primary care, every event,
Right.
whether it's diagnosing them with cancer, telling them that they're dying, telling their loved ones that their family member is going to die. These are all of the things that is going to happen, right? But I am worth that dollar amount. Physicians were never taught how to work with money, how to deal with money. And we're almost told that you're not worth that, especially in the corporate sector. You were not worth that a dollar amount. You were not worth that promotion. And when it's very disheartening. And when I got over that and I realized, no, I am worth this. I am this. I actually better serve my patients in a whole different way.
Yeah.
You know, it's such a fascinating journey, but to see how because I've now been in concierge care for almost 2 years now. And I've really just seen this journey in myself and how that related to the better quality patient care and experience they get.
It does give you confidence when you see the outcomes, right?
Oh my God, yes.
I think that's a part of all learning curves. You're going to do something new. You're going to learn. It's going to be uncomfortable in the beginning of that. But that's been my experience as well. Is like, I know how much good I'm doing. You know, I see it in my patients' results. I see it in their gratitude. And I just feel very, you know, I'm fulfilled in my work now, you know, rather than, I didn't have enough time for this. I should have read more echoes. I should have did whatever that is.
It's interesting too, because even I have some friends that recently graduated residency and, you know, a couple years into being a hospitalist, they're already burnt out, which I'm seeing that in the younger generation of healthcare providers, that they're getting burnt out sooner than we ever did because it's discussed more. The expectations are different. Everything's quite different. And even I was chatting with them just in general about like concierge, because they are thinking they might want to leave being a hospitalist and go out in the world. And I kind of shared this conversation with my husband. My husband goes, well, would you ever do anything else besides being a concierge doctor? I said, no, I wouldn't, because you actually gain so much more. You can't go back after that.
Yeah, I've said that 100 times.
You can't.
I've been asked, you know, would you go back to Mayo Clinic? And I'm like, absolutely not. I love Mayo's a wonderful place. I'll never be employed again. Like, you know, this is my being able to deliver care the way I want to deliver it for my patients has just been too valuable.
And they see that. The patients feel that.
Yeah.
They feel the different experience when they walk in the door. They do.
You'd mentioned Benessair's a premier practice here. You have some aspects of your practice that I'm really curious about. Exciting. Let's start with hyperbaric oxygen. I'm really like that. You don't see that in every primary care practice. So tell us who does that benefit? Like, what's the role of hyperbaric oxygen?
So hyperbaric oxygen chambers, these are what we have are one of the few medical grade outpatient, because there's hospital systems here that do have them, but outpatient medical quality hyperbaric chambers. Hyperbaric drives oxygen, because it's pure oxygen in the chamber. It drives oxygen into the cells at a higher rate than we would if we were just sitting in the regular environment. It does kind of build up. So if you do multiple sessions in a row, you are going to feel more intense benefit from it. We will use it for patients post-surgical procedures. We've had patients in there with cancer, mold, which people are starting to talk more about mold exposures and how that wreaks havoc in our system. And then also longevity. So for brain and overall health, wellness, pain reduction, inflammation reduction. By driving that oxygen into the cells, you're allowing the cells to repair themselves. It's really getting into the mitochondria, helping that energy function of our powerhouse of our cells, and really optimizing that healing and control. My best example, because I think a lot of people physically see this, patient comes in with a facelift. Everyone knows a facelift is terrible. It's painful. You're swollen. People kind of get that image in their head, right? I've seen where patients have come post-op day 0 or day 1 or 2 after, and it's cut down their healing time from 6 weeks to 2 weeks.
Wow.
So in 2 weeks, there is no bruising, there is no swelling. I mean, obviously, they're going to continue to look different over that 6 months as everything sets in, but you can't tell that they just had surgery.
That's fascinating. I mean, well, it is used in medical practice for healing wounds,
yep,
right?
Mm-hmm.
So that makes a lot of sense. Do people generally have a subjective sense of feeling better? And if they do, what is it?
So, I mean, I will say patients after their first session, depending on the severity of whatever they're going in for, will notice some improvement. When you've built that up more, so say if you've done 3 sessions in a week, you're going to really feel that. So a lot of patients who are doing it for wound healing or for so we've had also a couple of skin cancer patients that were going to have some really horrific face grafts. Literally went from having to have a graft to after a month, no graft needed on the face.
Really?
And so like that patient in particular, she wasn't complaining about aches and pains, but she had a hole on her forehead, unfortunately. From skin cancer. And she doesn't need surgery after a month. So for her, that's also a mental and physical improvement. I've had other patients that come in about 3 or 4 times a week for mold. They've had mold exposures that are really causing chronic fatigue and other health issues that are downstream. And they notice a difference every day that they're going into the chamber. So they're coming in 3 times a week to kind of really help their body heal itself too.
Is a session a standard amount of time, or is there
It's variable. So we do it in increments of 60, 90 minutes, or the kind of the most common. 2 hours is a possibility as well. But I find that most patients get a little stir crazy and can't sit in a chamber that long. But it's a pretty phenomenal experience. And we've got 4 chambers. There's 2, myself and Dr. Bordinko, the founder of the practice. We're both board certified physicians. We have great service on the machine. So I know some people have some hesitation. I promise you, like, we are the best at ensuring that our machines are safe. There's protocols. We have certified hyperbaric chamber techs on site as well, and a physician's on site all the time that's advanced life support certified.
And so what can the patient do during these 90 minutes? I mean, can they be on a computer?
Oh God, no. Okay. No electronics inside. You were going in with cotton clothing, nothing in your pockets, no computers, no sparks allowed. No computers, so that is something that a lot of our younger patients are like, oh God, I can't go in with my phone. Well, we have TV, so they can watch a show. The TV screen is outside of the capsule, and then speakers are kind of on the outside that they can hear.
Can they read a book? Or
no, that's paper. You can't. That's going to catch on fire too.
Oh, interesting.
So they can do podcasts, so they can listen to podcasts, and then some go to sleep. Yeah. Especially if they're just healing from a big surgery, they go to sleep. Yeah. I will tell you that when I've done it, every night I've slept amazing afterwards.
Really?
The best sleep.
Oh, that's awesome. And can people do the hyperbaric oxygen that are not in your practice, or is it only for your patients?
Yeah, so it's kind of cool. We have a lot of service lines that you do not have to be a concierge patient. So most of the people that do hyperbaric aren't concierge patients, because myself and Dr. Bordinko are the only providers there. We have a low patient panel because of the level of quality care we like to provide. So we have hundreds of patients that'll go through hyperbaric, and they may not be patients of ours. So you don't have to be, but a lot of patients do everything, and other patients just do one line of service at our organization. Yeah.
You guys, the other thing I wanted to ask you about was the photobiomodulation. There's a lot of talk about this, red light and things. Can you just give us the landscape of this?
Yeah, so PBM is what we call it for short. It is a bed of different photo rays of light. So we've got yellow, red, and blue light. Each of these rays of light will work on our cells a little differently. So we do have different protocols. Skin, brain, inflammation, energy. There's all different protocols, which is different variables of these lights, which will help in different modes. So we do have a really phenomenal medical grade machine. It is amazing, but it is tailored to the patient and what protocol they want to do. So patients who will use that, it will help with wound healing. It will help. I've had some patients with some bad rashes, eczema or psoriasis go in there, or Grover's disease. It's really helped with that. I've had patients that couldn't tolerate hyperbaric because they were claustrophobic, and they were going in there post mastectomy or post other surgery, and that was really helping with their wound healing and repair as well. You will have patients that are going in for brain to kind of help with their brain activity. So some patients with mild to moderate dementia, we'll be able to walk them in. We have some patients with Parkinson's that'll go into. And these are all things that'll help our cells. It's going to help our cells increase our ATP, which is in our mitochondria for our energy house. It's going to help improve cellular function for healing, decrease our inflammation, which really, if you look at it, most disease processes are a form of inflammation. So you can see how that's going to help. What's cool about our bed machine too, it is 360 around.
Oh, really?
So it's not just a light mask on the face,
Right.
which is, I did mention too, obviously help with wrinkles, and everyone wants to do that in Scottsdale. But it really is going to get your entire body. So it's not focused on one area. So some people will go in there for their arthritis. They have rheumatoid arthritis or regular osteoarthritis, and it's really helping to reduce their inflammation as well.
That's really interesting. So there are a lot of devices to grow hair, to get rid of wrinkles. You can buy them on Amazon, as you just said, but those are just a shadow of what is available as a medical grade, device. Is that right?
That is correct. Yes.
Yeah. And how do you? So you said it's a specific protocol for that patient. Does somebody who's not a patient in your practice, do they get like an evaluation before and then they decide what's best?
Yeah, we have some team members that assist with that. So Hyperbaric, they do have to have a formal physician clearance, which is done by myself or Dr. Brodinko. And then, but with the PBM, the light bed, that's a little bit more self-driven. They kind of tell us what's happening, what their concerns are in a soft approach, if you will, or if they're a patient of our concierge practice, then we will give them the protocol, what we would want to do.
I see. Great.
Yeah. So we help with that piece.
Another thing I really like about your practice, one, you can take care of people when they're sick, conventional medicine. You and Dr. Brodinko both are traditionally trained physicians. You talk about a proactive and a functional, integrative approach to health. But you also talk about peak performance as well. And you have a team that has, you have a physical therapist, you have trainers, this is a remarkable aspect. I've never been in a medical practice that had that kind of availability. But, we also know, you knew this as functional medicine, me as a cardiologist, that exercise is medicine. Like a lot of things that we treat traditionally with drugs could be treated with physical activity. Tell us how that works in your practice, the training aspect.
So we are lucky to have a state-of-the-art gym facility in the center. It is literally the hub of our clinic. When people come to visit our clinic, they will realize it is not a medical practice. You kind of walk in and you have really no idea where you've just been transported to, because it's not a clinic. It doesn't have that vibe. The gym is phenomenal because we can train anyone from post-op, from like a total knee or total hip replacement. We have patients from, I think, 14 all the way to 90 operating in our gym with our trainers. We have 3 personal trainers and we have 2 physical therapists on site. The physical trainers are great when you're just when you are optimally well, you're not having a lot of specific, joint aches or pains or an injury. They're going to walk you through a whole entire routine. Our physical therapists are going to be more specific when there is an injury. They also collaborate. So someone might see our physical therapist once or twice a week and then see our personal trainers, and then they'll tag team together. Example, a patient with having a rotator cuff tear, the physical therapist is going to be working with them on upper body to really make sure that they're watching every single movement, but they can also do the hands-on modalities that are needed. And then the personal trainer is going to work on the lower body those other days. Right. And so it's a really beautiful collaboration. It's phenomenal, the team effort. And then they also then just tell me what's going on. So say example of patients like, man, I think I pulled something, this or this. I kind of twisted my ankle. They're going to tell me. They might even just grab me if they know I'm available. Hey, so, Joe over here twisted his ankle. Am I safe to proceed? I do a physical exam right there on the spot, give the clearance, or just say, hey, let's just do upper body. Right. So the collaboration approach really allows patients to get to their peak performance.
That's amazing, right? Like one of the real limitations of medicine is this siloed approach. you have to go to this doctor for this, and you need to go to this physical therapist for this. You're tying this all together.
Yeah.
Is this also the physical therapy? Is that only for the concierge patients, or that's
same? It's all a la carte. So
Right.
the concierge is just its own entity. People on the outside can use any of the things. We also have 2 massage therapists on site because that is important for relaxation, mindset. They both do a little different techniques, so it's really phenomenal. I also do osteopathic manipulation as I'm a DO, so I'm doing that as well. And some patients, again, get all of these service lines because they all work in their different way. But then I can say, okay, they can't do manipulation after they've done XYZ. Like, I don't want them to go do manipulation and then go do physical therapy right after.
Right.
You know, so we get to talk about that, and then we get to change our schedule right there on the spot together.
Yeah.
So it's pretty phenomenal, that collaboration approach. And it really, again, ultimately allows them to have peak performance.
Yeah, that's great. Longevity, we started with that. It means a lot of different things to different people. Kind of a buzzword these days. I don't know if it's one that you use in your practice, but if you do, how do you frame it? Like, what do you think about longevity?
I do frame it a little differently. I know our motto at Benessair is live better longer. I talk about health wellness and health longevity, if you will. People don't want just a span of XYZ. They want health.
Right.
So I talk about restoring health more. That's kind of my phrase on it, if you will. But yes, longevity is a big buzzword. People hear it, but really ultimately, what does it mean? Someone is living a happy, healthy life.
Right.
Mediating those risk factors, reducing disease, reducing inflammation.
Wow.
Yeah.
This has been such a great conversation. I'm really just so appreciative of you sharing with us. I know there's going to be patients out there that are like, okay, I need to know more about Dr. Eller, Benessair. Where do they go to get more information?
So Benessair.com, or you can also type in my name, Dr. Linda Eller. And we're kind of Scottsdale, Paradise Valley, but you will find us in Paradise Valley. That is the best place to look us up.
Great. Thank you, Dr. Eller.
Thank you.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.